Okay, this is chapter 26 of Maternal Newborn, Nursing Care and Discharge Teaching. Discharge teaching and newborn care include bathing, umbilical cord care, circumcision, car seat safety, environmental safety, newborn behaviors, feeding, elimination, and clinical findings of illness to report to the provider. Prior to discharge, a nurse should provide anticipatory guidance to prepare new parents to care for their newborn at home. Clients and newborns are normally discharged 48 hours following a vaginal birth or 72 hours following a cesarean birth. Serious complications can result if improper discharge instructions are given to the parents prior to taking the newborn home. A nurse should inquire about the family's experience and knowledge regarding newborn care, anticipate the learning needs of the parents, and assess their readiness for learning to provide education about newborn care. Parents should be made aware of general guidelines about newborn behavior and care. These guidelines include causes of crying in the newborn, quieting techniques, sleeping patterns, hunger cues, and feeding, bathing, and clothing the newborn. Parents need to be aware of the importance of newborn checkups, immunization schedules, and when to call the provider for manifestations of illness. Providing a safe, protective environment at home should be stressed to new parents and should include instruction about proper car seat usage, which is a very important part of the discharge instruction process. Assessment of family readiness for home care of the newborn. Previous newborn experience and knowledge, parent-newborn attachment, adjustment to the parental role, social support, readiness of the parents to have their home and lifestyle altered to accommodate their newborn, and parents' ability to verbalize and demonstrate newborn care following teaching. Interventions for home care of the newborn. Through discussion, pamphlets, and demonstration, provide education to the client and family regarding newborn behavior, quieting techniques, newborn care, findings of newborn well-being and illness, and issues of newborn safety. Crying. Client education. Newborns cry when they are hungry, overstimulated, wet, cold, hot, tired, bored, or need to be burped. In time, parents learn what the newborn's cry means. Do not feed the newborn every time they cry. Overfeeding can lead to stomach aches and diarrhea. Newborns often have a fussy time of day when they cry for no reason. In this case, it is not always possible to stop a newborn's crying, and the newborn might cry themselves to sleep. Quieting techniques: swaddling, close skin contact, rhythmic noises to stimulate uterine sounds, movement like car ride, vibrating chair, infant swing, or rocking the newborn, placing the newborn on the stomach across the holder's lap while gently balancing legs, in-face position for eye contact, when parents and newborns' faces are about 30 centimeters apart and on the same plane. Stimulation, sleep-wake cycle. Newborns sleep approximately 16 to 19 hours a day, with periods of wakefulness gradually increasing. Many parents believe that adding solid food to the newborn's diet will help with sleep patterns. During the first 6 months of life, the American Academy of Pediatrics recommends only breastfeeding. Most newborns will sleep through the night without a feeding by 4 to 5 months of age. The provider will instruct the parents when to add solid food to the newborn's diet. Client education. Placing the newborn in the supine position for sleeping greatly decreases the risk of sudden, unexpected infant death, or SUID. Keep the newborn's environment quiet and dark at night. Place the newborn in a crib or bassinet to sleep. The newborn should never sleep in the parent's bed due to the risk of suffocation. Most newborns get their days and nights mixed up. Basic suggestions for helping develop a predictable routine. Bring the newborn out into the center of the action in the afternoon and keep them there until bedtime. Bathe them right before bedtime so that they feel soothed. Give them their last feeding around 2300 and then place them into a crib or bassinet. When awake, the newborn can be placed on the abdomen to promote muscle development for crawling. The infant should be supervised. For nighttime feedings and diaper changes, keep a small nightlight on to avoid having to turn on bright lights. Speak softly and handle the newborn gently so that they go back to sleep easily. Positioning and holding of the newborn. Head support. The newborn has minimal head control. The head should be supported when the newborn is lifted because the head is larger and heavier than the rest of the body. Basic ways to hold a newborn: the cradle hold, upright position, and the football hold. Cradle hold is the cradle the newborn's head in the bend of the elbow. This permits eye-to-eye contact and is a good position for feeding. Upright position. Hold the newborn upright and face them toward the holder while supporting the head, upper back, and buttocks. Football hold. Support half of the newborn's body in the holder's forearm with the newborn's head and neck resting in the palm of the hand. This is a good position for breastfeeding and when the shampooing of the newborn's hair. Swaddling. Parents should be shown how to swaddle their newborn. Swaddling the newborn snugly in a receiving blanket helps the newborn to feel more secure. Swaddling brings the newborn's extremities in closer to the trunk, which is similar to the intrauterine position. Bathing. Teach the parents proper newborn bathing techniques by a demonstration. Have the parents return the demonstration. After the initial bath, the newborn's face, diaper area, and skin folds are cleansed daily. Complete bathing is performed 2 to 3 times per week using a mild soap. Client education. Bathing by immersion is not done until the newborn's umbilical cord has fallen off and the circumcision has healed, if applicable. Wash the area around the cord, taking care not to get the cord wet. Move from the cleanest to the dirtiest part of the newborn's body. Cleaning with the eyes, beginning with the eyes, face, and head. Proceed to the chest, arms, and legs, and wash the groin area last. Bathing should take place at the convenience of the parents, but not immediately after feeding to prevent spitting up and vomiting. Organize all equipment so that the newborn is not left unattended. Never leave the newborn alone in the tub or sink. Make sure the hot water heater is set at 120.2 degrees or less. The room should be warm and the bath water should be 98 to 99 degrees. Test water for comfort with your elbow prior to bathing the newborn. Avoid drafts of chilling of the newborn. Expose only the body part being bathed and dry the newborn thoroughly to prevent chilling and heat loss. Clean the newborn's eyes using the clean portion of the washcloth. Use clear water to clean each eye, moving from the inner to the outer canthus. Each area of the newborn's body should be washed, rinsed, and dried with no soap left on the skin. Wrap the newborn in a towel and swaddle them in a football hold to shampoo the head. Rinse shampoo from the newborn's head and dry to avoid chilling. To cleanse an uncircumcised penis, wash with soap and water and rinse the penis. The foreskin should not be forced back or constriction can result. To cleanse a circumcised penis, do not use soap until the circumcision is healed. Wash the vulva by wiping from the back to the front, from front to back to prevent contamination of the vagina or urethra from rectal bacteria. Applying a fragrance-free, hypoallergenic, moisturizing emollient immediately after bathing can help prevent dry skin. Feeding elimination. Newborns who receive breast milk should have 3 or more bowel movements per day. Formula-fed newborns are less frequent. Newborns who receive breast milk should have 6 or more wet diapers per day. Formula-fed infants have a similar number of voids. Diapering. To avoid diaper rash, the newborn's diaper area should be kept clean and dry. Diapers should be changed frequently and the perineal area cleaned with warm water or wipes and dried thoroughly to prevent skin breakdown. Provide instructions regarding perineal cleansing of the vulva or for the circumcised or uncircumcised penis. Cord care. Before discharge, the cord clamp is removed. Prevent cord infection by keeping the cord dry and keep the top of the diaper folded underneath it. Client education. Sponge baths are given until the cord falls off, which occurs around 10 to 14 days after birth. Tub bathing and submersion can follow. Cord infection, which is a complication of improper cord care, can result if the cord is not kept clean and dry. Monitor for manifestations of a cord that is moist and red, has a foul odor, or has purulent drainage. Notify the provider immediately if findings of cord infection are present. Clothing. Instruct the parents about care for and choice of newborn clothing. Client education. Choose flame retardant fabrics. Wash clothes separately with mild detergent and hot water. Dress newborns lightly for indoors and on hot days. Too many layers of clothing or blankets can make the newborn too hot. On cold days, cover the newborn's head when outdoors. A general rule is to dress the newborn as the parents would dress themselves. Home safety. Provide community resources to clients who might need ongoing assessment and instruction on newborn care or adolescent parents. Client education. Never leave the newborn unattended with pets or other small children. Keep small objects or coins out of the reach of the newborns due to choking hazard. Never leave the newborn alone on a bed, couch, or table. Newborns move enough to reach the edge or fall off. Never place the newborn on the stomach to sleep during the first few months of life. The back-lying position is the position of choice. Provide education on the importance of tummy time, which is allowing the infant to lie in the prone position for 3 to 5 minutes, 2 to 3 times each day. The newborn can be placed on the abdomen when awake and supervised. Never provide a newborn with a soft surface to sleep on, like pillows or waterbed. The newborn's mattress should be firm. Never put pillows, toys, bumper pads, or loose blankets in a crib. Crib linens should be tight-fitting. Do not tie anything around the newborn's neck. Monitor the safety of the newborn's crib. The space between the mattress and the sides of the crib should be less than 2 finger breadths. The slats of the crib should be no more than 2.25 inches apart. The newborn's crib or playpen should be away from the windows and blinds and drapery cords. Newborns can become strangled in them. The bassinet or crib should be placed in an inner wall, not next to a window, to prevent cold stress by radiation. Smoke detectors should be on every floor of a home and should be checked monthly to ensure that they are working. Batteries should be changed twice a year. Eliminate potential fire hazards. Keep a crib and playpen away from heaters, radiators, and heat vents. Linens could catch fire if they come into contact with heat sources. Control the temperature and humidity of the newborn's environment by providing adequate ventilation. Avoid exposing the newborn to cigarette smoke in a home or elsewhere. Secondhand exposure increases the newborn's risk of developing respiratory illnesses. All visitors should wash their hands before touching the newborn. Any individual who has an infection should be kept away from the newborn. Carefully handle the newborn. Do not toss the newborn up in the air or swing them by their extremities. Do not shake the newborn. Car seat safety. Use an approved rear-facing car seat in the back seat, preferably in the middle, away from airbags and side impact, to transport the newborn. Keep infants in rear-facing car seats until the age 2 or until the child reaches the maximum height and weight for the seat. Newborn wellness checkups. Every newborn should be seen and examined at the provider's office within 72 hours after discharge. The AAP recommends wellness checks at 2 to 5 days, 1 month, 2 months, 4 months, 6 months, 9, 12, 15, 18, 2 years, 2.5, 3, 4, and every year after. Review the schedule for immunizations with the parents. Stress the importance of receiving these immunizations on a schedule for the newborn to be protected against diphtheria, tetanus, pertussis, Hep B, the flu, polio, measles, mumps, rubella, rotavirus, pneumococcal, and varicella. Manifestations of illness to report. Instruct parents regarding the manifestations of illness and report them immediately. A temperature greater of 100.4 or less than 97.9. Poor feeding or little interest in food. Forceful vomiting or frequent vomiting. Decreased urination. Diarrhea or decreased bowel movements. Labored breathing with flared nostrils or an absence of breathing for greater than 15 seconds. Jaundice, cyanosis, lethargy, inconsolable crying, difficulty waking, bleeding or purulent drainage around the umbilical cord or circumcision, drainage developing in eyes. CPR. Encourage parents to seek CPR training. Complications related to newborn home care. Complications stemming from improper understanding of discharge instructions can include the following: infected cord or circumcision from improper care or tub bathing too soon, falls, suffocation, strangulation, burns resulting in injuries, fractures, aspiration, or death due to improper safety precautions, respiratory infections due to passive smoke or inhaled powders, improper or no use of a car seat resulting in injuries or death, serious infections due to lack of non-adherence with immunization schedule.